we'd like to welcome everybody to our special session with Rola Allahaweh from Amman, Jordan. We're so grateful to have the National Clinics Collaborative and the great work that Katie and her colleagues are doing on disabilities and medicine in the webinar series that we're presenting to you all. So today we have a special guest. We happen to be recording this on September 21st, which is the International Day of Peace, which is very apropos for who we're going to be spending time with today. Rola is someone that is really committed to peace, understands the value of peace, and is working hard to promote peace in Jordan and throughout the Middle East and around the world. And you'll understand why this topic is so important to her when she shares a little bit about her story. So Rola, welcome to the National Clinics Collaborative today. It's so good to see you.
Thank you. Thank you. Me too. I am so happy to see you guys and to be with you.
Excellent. So do you mind if we start with your story? I know that it is not an easy story to tell. I know that your story does not define who you are, but I also know you are never shy to share your story because you wanted to impact people everywhere. So do you mind just to share a little bit about your story and provide the background and context for us today?
Yeah, actually, I'm not shy, you know, and I don't have any problem to talk about, you know, the let's say the story of my disability. I am a victim of terrorist attack. You know, it's targeted my country in 2005. 3 hotels, you know, exploded by bombers. 3 bombers, they attacked 3 hotels same time, where 60 people died that night. And I was the worst case in the 3 hotels that causes me a complete tetraplegia. So it was hard. It was hard. Yes, it was hard. But, you know, this is the life. We cannot get everything, you know, make us happy. Sometimes we need to suffer, but, you know, in the end, we need to continue this life. And this is what I decided later on to continue. That time I was a nurse working in the emergency department. And later I decided that why not? Okay, I can accommodate my job. I can start and return to my job and to face the stigma of disability in my country. In Arab country, to be a female with disability is so hard, but, you know, for me, I decided to change this, you know, let's say this view or this opinion. And I want to show them that I am, you know, okay, I am a female with disability, but I'm not a burden. I'm not a burden on my family. I'm not a burden on my country. I am not a burden on anyone. So I continue my work as a lecturer. I decide post the injury to continue also and to improve my learning and my studying. I had master's degree in 2009 from King's College London, and in this let's say specialty and in my master's degree, I decided to study about living experience with the spinal cord injury to know how to help these people with disability in my country and change the impact about them and help them to fight and find the best way for high quality of life.
Thank you. So Rola, you were in a hotel. You were celebrating your cousin's wedding. How
Yes.
old were you when the suicide bombing happened and your life was changed forever? How old were you?
I was 24 years old. Now I am 40. Now I am 40. So we are talking about, yes, we are talking about 16 years.
Yeah.
Now facing the challenges, and I will not stop.
No, you won't. You won't. So you were 24 years old, and literally overnight, your life changed. Um,
Exactly.
and can you describe your injury? And you described as a complete quadriplegic, but can you describe, it wasn't necessarily a traditional spinal cord injury. So can you describe to the students um, what exactly the injury is and what the effects of that have been?
Uh, if I want to simplify what is my injury, quadriplegia is the paralysis of the four limbs. My four limbs is paralyzed. With rehab, I can move my shoulders, but I can move my fingers. I can't uh, move my lower legs as well. Uh, this kind of injury, it's, very hard, and I had it because of, the shrapnels in my body. I have many shrapnels in my body. I have one in my brain, there's one in my neck, which causes my disability, and I have one in my back, and still I have them in my body, and they became now a part of my body.
Mm-hmm, mm-hmm.
So how this impact on my life? Actually, I can't, practice very well, and help myself and be totally independent. So I am verbally independent. I can help the people how to help me, but physically I am totally dependent on my carers.
Sure, sure. So can you describe a little bit, because I know for the sake of the collaborative group, we're really interested in how, as future doctors, those serving in the medical care system, so that we can have more awareness and empathy and understand communication and understanding the needs of people with disabilities that we serve. You have been through a lot of rehab in Jordan, in Europe, and sadly, you have experienced the American medical system due to an accident while you were here on one of our programs. So can you explain a little bit of the journey of your rehabilitation immediately after your injury? So when you woke up from the coma, which was 2 weeks later after the accident,
Exactly.
when you started rehab, can you describe any critical moments of rehab, or the way a physiotherapist or a doctor interacted with you that was particularly transformative or positive for you? So maybe give us one positive example, and then maybe give us one negative example where it was something that didn't serve you well.
So actually, this question is very critical, and still we have this problem till now. So if you, in the positive way, if you are lucky, you will find someone or at least have experience how to deal with people with disability or with a spinal injury. Otherwise, you will suffer. For example, usually when I have when I feel like I have dizzy, I feel I am not feeling okay, when I go to the emergency department, these people have no experience about spinal cord injury, or sometimes you need general information, especially about people with quadriplegia. So they check my blood pressure, they start giving me IV fluids, because gosh, your blood pressure is very low, your blood pressure. But these people should know that it is normal. This is my normal blood pressure. So what they are doing, they are giving me excess of a fluid. So the positive way, that if you, as I again, I need to mention that for me, the healthcare providers, all healthcare providers should have an introductory course to know at least, how to deal with people with disability. Not just physically, to be honest, Dr. Sarah. Sometimes you are in the hospital, but you can hear their jokes.
Mm.
So how the people communicate with us, you know, I'm not looking for sympathy. For example, you are going to the hospital, you are waiting outside, you know, for the lift. All the people go inside the lift and leave you out. But before they go inside the lift, you know, they keep, oh my gosh, she's young, she should not sit on the chair. So guys, I don't want your sympathy, I want your empathy. Just press the lift for me to help me to go inside. Did you understand what I mean? So it is not just how they can help us physically. Also, we want them to know how to deal with us psychologically, how to understand our feeling, how to be in our shoe, you know. So sometimes, you know, they're easy for you to tell you, do this, do this, do this, do. But you can give me the order, but this is not. What can I do? So it's easy for you sometimes to give you, they're easy for them to give you a suggestion, forgetting what you can do or what you can do.
Mm.
So this is the positive way and the negative way. So the positive way, we need someone at least have basic knowledge, about disability. So the negative way, we are going to be a victim of the healthcare providers' mistakes.
Mm-hmm. Mm-hmm. So there is one incident that I will never, ever, ever forget, being in the hospital with you. So do you mind to describe the accident that we had while you were in the United States on one of our programs, that sent you to the hospital here, giving you the opportunity to experience healthcare in the United States? So can you just briefly describe the bus accident? And then we took you to the hospital because you were having pain. And then we'll stop there because I want to get to one example in particular.
My accident actually was, you know, in my last night. It's in the program. We were finishing up and we are going to the hotel because we finished the program successfully. That night, you know, the protocol, this is what they do in the United States, that usually they take care of people with disability on the bus and they stabilize the wheelchair on the floor of the bus, and they stabilize also the let's say the wheelchair user on the chair. So that night, the driver, we don't know, for a reason, you know, he forgot to, you know, to strap me. So he stabilized the wheelchair on the floor of the bus, but he forget to stabilize my body on the chair, and he slammed the brake. That that's you know that's the last thing I remember. Then I, like, you know, I remember I can say simply, I can say I jump out of my chair. I couldn't, you know, feel anything in the beginning, but I just hearing, you know, my brothers, my sisters, they are shouting on the driver to stop. I remember when Shams told him that you can't drive in this way. We are sitting on wheelchair and we don't have balance on our chair like our brothers and sisters who doesn't use the wheelchair. So they tried to pull me out of the floor to return me to the chair. But that night, you know, I was in pain, in severe pain, and couldn't, you know, tell how I was in pain because of this falling down.
Oh, I'm so sorry.
No, it's okay.
Okay, so the next day we took you to the hospital because you knew something was wrong.
Yes,
And
when my legs start to swallow. My
that's
legs
right.
was so, yeah, my both legs were so big.
Yeah.
The edema informed me that I broke my bones.
Yeah. So we went to the hospital, you had some x-rays, and what horrible news did they give us?
You know, I was, you know, in pain. I was trying to tell the people in pain. You know, when the nurse came and the, you know, I was, you know, looking that I don't want to hear any bad news. But I still remember when he told me, sorry to tell you, yes, you broke my 2 bones.
Yeah.
And that, you know, that information, it's like, you know, make me like out of the world.
Yeah.
Like, oh, this
So,
is not
Rola,
what I want to hear.
for sure. Remind me, you broke your femur and your tibia. And later
Yes,
on, we found that you also broke your ankle and wrist.
exactly.
Okay.
And ankle and the clavicular, actually.
Okay. So it was a bad, bad, bad break and fall. Um, so this is the incident that I remember the most, is when we went to follow up at one of the doctor's appointments, and it was a female doctor that came into the room, and her assumption was, because you were in a wheelchair and identified as quadriplegic, was that you had a spinal cord injury, that and her assumption was that also meant you don't have any feeling in your leg.
Exactly.
But with your injury, that's not the case, because you don't have a spinal cord break, you have shrapnel in your spinal cord. So
Exactly.
you still
Exactly.
have feeling in your legs. And she was quite harsh and aggressive in moving your leg to describe to you the break. And you screamed in pain. And she looked at you and said, "Why are you screaming?" And you said, "Because that hurts very bad." And she said, "That's not possible. You're a quadriplegic. You can't feel that." And you said, "No, I feel pain." And she said, "The pain you're feeling is not real. Stop being so dramatic." Do you remember this?
Exactly. Yes, she thought that I was overreacting and seeking attention. This is how she described my pain that night.
Exactly. And so I think this is sadly a, a wonderful case study that, as doctors, how important it is that we don't make assumptions about our patients, and how
Exactly.
important communication and honoring your patients is. So can you speak a little bit about this from your perspective, and any advice that you would give to our students on this topic?
You know, you know, the pre-assumption for any case is wrong. We always in nursing school, I remember our teachers taught us about the uniqueness of case. So every patient is a unique case. You can't judge or deal with all patients, treat all patients the same. Also listen to the pain of your patient. I was crying, I was in pain, and she was you know explaining my pain as overreacting and seeking attention, you know and she did not even bother herself to check about the pain. you know and you remember, later on, I stay in the hospital, trauma hospital, for 2-3 days. I was in pain, in pain, in pain, and nobody listened to my pain. Then they transfer me to another hospital, and I was keep you know I was keep complaining of pain, except one of them, OT therapy. When she tried to help me, I shout that, and she noticed the bruises and the edema of my ankle. Then she asked for another X-ray, and they found that I really broke my ankle, and nobody believed that this pain was because I really broke my ankle. So what I want to say to the people, never judge the people. Never judge the people. You know, pain, when I complain of pain, it's mean I am in pain. But the
Yeah.
problem of the health team member, they think that if you are in pain, it's mean you are either seeking attention because the female, this is the pre-assumption, always female is seeking attention, or this patient was asking for a painkiller. And I'm not going to give a painkiller because this patient gonna be very addicted soon. So I can't forget how was 1 week of pain, complaining of pain on pain. And you know, I still have the, let's say, the scar of this, you know, fracture in my leg. Now I always cover my, I can't wear something, you know, short. I always put a bandage on my foot because I didn't find the suitable care from the first night. Nobody, you know, deal with this swelling, treat the swelling. So this swelling was pressing on my nerves, pressing on my, you know, vessels. And thanks God I didn't lose my foot that time.
Yeah. Yeah. So Rola, obviously, I mean, you work in medicine. You understand, what is it? We call it not compassion fatigue, but you know, doctors and nurses, somehow we build a wall of protection around us, and you know, we're overworked, we're exhausted, we have to just move through things quickly. We know it's, how do we remind ourselves, like you said, that every patient is unique, and the communication with that patient, and truly listening with empathy, not listening with, I've got to get through all my rounds. And I know that there's a delicate balance in that, almost where we become so hardened that we can no longer have empathy for each other, because in order to protect ourselves and the things that we see, and to manage the psycho-emotional challenges of being in the medical field, we turn off our emotions. How do
Exactly.
we make sure that we're not turning off our emotions and we're bringing our full empathy to each patient? Do you have any advice for us around this?
I think, you know, always the main, you know, let's say the main complaint from the healthcare provider that they have no time to speak with their patient. The patient needs someone to listen, not to hear.
Mm.
So I wanna, each healthcare provider, you know, even the policy, sometimes it's not the fault of the healthcare providers themselves. It's the fault of the policy, you know, to give these people, you know, the healthcare providers, I mean, you know, the chance to not be judgmental, because, you know, working long time in the emergency, working long time in the ICU unit, you know, the healthcare provider will have something we call it burnout. So if the work will become for them is a routine, or it's a job to have money and go home. So, and this is not the medicine or nursing. Our job is totally different. So listening, the patient needs someone to listen, not to hear. So use the sense very wisely.
Mm-hmm.
Also, yes, all of us have their own, you know, problem in their houses. You know, maybe they have their own problems, they have their, you know, financial problem, psychological problem, but the patient should not pay for this, you know, problems, you know,
Mm.
empathy, empathy, and believe in your patient. Believe anything the patient will say. Don't judge it, you know, from, you know, a previous experience from another patient. You can't use this previous experience to generalize. this, you know, point of view for all the people.
Yeah, I think that's a great point, because in being with you throughout that, we were in the hospital 5 or 6 weeks after the bus accident,
Yes,
right? And
yes,
so experiencing different hospitals, different doctors, different nurses, different therapists, gosh, I learned so much. And as I step back and think about observing what was happening, and there were so many layers of stereotypes or assumptions, right? So you have
exactly,
a highly educated American doctor who is looking at a woman with a disability from a different country, and knowing absolutely nothing about you. And the assumption was you had no idea what you were talking about. You were seeking attention and were overly
exactly,
dramatic. You were uneducated. A
exactly,
lot of assumptions. And the reason we know that those assumptions were being made was because of the types of conversations that they were having. And if I'm really honest, it was so hard for me as an American that is hosting you not to speak for you. You know, I wanted to talk to the doctors for you because they weren't listening to you. They weren't respecting you.
exactly,
But it was so hard for me to say, no, 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 no. Do not speak. Help give the voice, help them understand that Rola's voice. So, you know, sometimes they wouldn't even talk to you.
yeah,
They
exactly,
to me about you or for you. And I would say, don't talk to me. She is the patient. Ask Rola. Do you remember this?
exactly,
That medical doctors address the person with a disability, no matter how severe or not, but they address that person rather than relying on the advocate or the caretaker. How important is this?
you know, actually, we don't apply what we study in books. What I mean, in nursing school and in medicine school, they always taught us that the first resource of information is the patient. I remember the first time they didn't listen to me or respect my opinion, and they didn't believe me. You remember when she asked me about you know, if there's incidents I was pregnant? I was telling the nurse, no way, I'm not pregnant. And she kept asking me, when the last time you have sex? I told her, no, this is not in my culture. And no, I'm not pregnant. She said, but even so, I will make a pregnancy test. And my sister, my carer, they were making joke last night. That's, oh my gosh, now you are pregnant in America, you know. So I didn't even, you know, believe me. And it's my right. I don't want to test for pregnancy. Also, you remember Dr. Sarah, when they pushed me to go to the gym, how many times they put me in the wheelchair and my legs were exposed. I'm not wearing a scarf, you know, hijab, but, you know, I can't expose, you know, my gown was so short. And the only person who noticed and covered my legs, you, not the nurses or the doctors around me. So forgetting the culture, forgetting, you know, let's say the privacy of the patient, the confidentiality, you know, was very hard there, because, you know, I watch many, you know, movies and, you know, in TV, and they keep talking about confidentiality, respecting the humanity, but this is not what happened with me. I was there, they always consider, and they speak in English while I am with them, and they considering that I don't understand what they are talking about.
That's
And
right.
they were, yeah, when taking about the diagnosis, they talking about the procedures, they will keep talking to you, not to me. And even, you know, when my sisters, my carer with me in the room, nobody asked me if I wanted them to be in the room while they are discussing with me. So nobody respects my privacy there. And this is not what they what's that, what they are always talking about.
Ah, that's a really good point, Rola. So if there's a person with a disability and they have a caretaker in the room with them, you are saying you would have appreciated if the doctor or nurse, before they give you new information or before you had to make a decision, if they had at least asked you, are you comfortable with your sister and caretaker in the room? Or would you like for us to have this conversation in private? To just acknowledge that and not make the assumption that they should also be privy to the decisions that you need to make. Is this what you're saying?
Exactly. Dr. Sarah, you know, the carer is, there's two kinds of carer. There is formal carer and there is informal carer. So the formal carer is the carer who you pay to help you, okay? And the informal is your family or your friends or someone you trust on everything in your life, money, everything. My formal carer, she was from Philippines, okay? And, you know, sometime, you know, she needs to know everything about me, but not everything.
Yeah.
Not same like my sister who was with me that time.
Yeah. So that's a great point. Just to be mindful and again, not make the assumption that you want everyone in the room, but just to check in and say, hey, Rola, we have new information. We have new updates. Would you like for us to say that in privacy, or would you like for your caretakers to be here with you? That's a great takeaway. Is there anything else from your experience, whether good or bad, that you think is important for our students to consider?
Yes, you know, here in Jordan, when we are talking about the American health, you know, system, and you know how it's very good and strong, it's like, you know, for us a good example to follow. But from my experience, there was many mistakes. One of the most mistakes for me is education. I was, you know, okay, I was a nurse, I was educated, but that night, because of, you know, let's say the numbness of the pain, you know, the shock, the denial, I was refusing to understand anything. And I couldn't find someone to explain to me. You know, they just come, give me the medicine and go. What's this? For what? Or the painkiller, even the painkiller. The first time I refused the painkiller, nobody come and bother, herself or himself to tell me, Rula, you are in severe pain. You need this kind of painkiller, and don't worry about the addiction, because I was worried about the addiction. To be honest with you, I was getting very strong painkiller, morphine. So keep going, giving me this kind of painkiller was scary. And I couldn't find someone to explain to me. Till I asked, I said, I need someone to ask about the medication. And every time, you know, they change the shift, you know, they change the medicine. And nobody explained why they change it, why they reduce the dose, why they up the dose, why they choose another medication. So explaining and education is very necessary for the patient to, you know, to overcome the problem, because with education, you won't feel that you are neglected. And you, if you remember my first night in the hospital, I was crying when you came, and I told you, I was begging you and, you know, Carly, every people, just to get me out of the hospital. I can't stay there. I was all the night asking for painkiller, and nobody come to me. And every time asking, tell me, okay, I'm coming back, I'm coming back, I'm coming back, and nobody listen to me. So all the patient, no matter their knowledge background, need education, especially people with disability. Our disability sometimes create scenarios for us. It's a new knowledge for us.
Yeah.
So don't assume that we know everything. We need someone to explain to us, to educate us. For example, look, Dr. Sarah, I am verbally independent because I know how to help the people to help me. But I am dependent. So help the patient, help people with disability to be verbally independent. This will help them at least to feel that they have the control of their body, the control of their life.
That's right. That's a great point, because just the psychological component of a person with a disability who has already been through, especially if you've acquired your disability, but regardless, whether you were born with it or not,
Yes.
You already have this lifelong battle with having lost control of your own body.
Exactly.
And what I'm hearing you say is it is all the more important for doctors and nurses to communicate, or maybe even over communicate with a patient, because the more informed a patient feels, the more empowered they feel, the more empowerment they experience, giving them control over their own body, which is something
Exactly.
already so important.
Exactly. Yes. This is exactly what I mean.
That's an excellent point. So even as we compare the way we care for persons with disabilities and without, and I'm an advocate for over communicating no matter what. I think people always should be informed about what is happening and why, and there's real reciprocity in that. But I am hearing you say that even more important for people with disabilities to be communicated with, because there's already an overwhelming sense of loss of control. And
Exactly.
this is a way to give the control and the power back to the patient in a way that will only help in the reciprocity needed for patient-doctor care to improve together. Is that?
Yes, exactly.
That's great. Well, I think this is a great way to wrap up. I wish that the session was not at 8 o'clock at night in the US, which is 3 a.m. in the morning in Jordan. But maybe if there are a group of students or even some of our faculty that are interested in scheduling a follow-up to your recorded series to ask any Q&A with you, would you be willing to join us to do that?
Of course, of course, of course. Actually, anything can help people with disability. I am very, very ready to do it, no matter the time. So guys, never hesitate. Anytime.
That's great. Can you just leave the students with, you came to America in 2018 for this program. You didn't see yourself as an athlete when you came. You saw yourself as someone advocating so that others could be athletes.
Exactly,
But you
exactly.
went home, and what happened?
I traveled to the state, as advocator. And, I always put in my mind that my disability is very high. So electrical wheelchair is good choice for me. But what I saw, what I learned, and what have been taught and listened and saw and watched, taught me that there's no limit. And no matter what the type of the disability, there is one way, and there is any way to help yourself. So I went back to Jordan, and my electrical wheelchair, it is still charging. I charge it every other day, but I don't use it. And if you see my gloves with me, I, start every day, doing exercise, pushing the manual chair to strengthen my hand, and more and more. And the best thing now, I am the captain of the Jordanian team, veteran team, so that we are, planning to participate in the Invictus game. Actually, we were, planned to in 2020, but because of COVID-19, scenario, we changed it to 2021. Hopefully, this epidemic will be, vanish from the world, and the people will live back, get their normal life again. So now I am the only female in the team, and I am the captain of the team. And maybe I should next time share you guys some photo for me pushing the racing wheelchair. And even I'm working now with One World Marathon, foundation in US, to use the sport as a tool, for peace.
That's right. The One World Foundation. And that was
Yes.
founded by someone who was affected by the Boston Marathon attack.
Exactly.
Right?
Boston. I received him here in Jordan. I worked with him, and we participated together. I will share, guys, the photos with you. He brought with him a special chair for the marathon, and we participated in Dead Sea Marathon. So this program, GSMB, totally changed my mentality about the sport. Additionally, my last presentation in the conference, in International Jerash Conference, was about parasport in Jordan. My presentation, it should be 15 minutes, but all the audience kept asking and were interested to know about the sport. So thank you, GSMB. Thank you guys so much.
You're so welcome. So you came to the States as an advocate. You went as an athlete.
Exactly.
Now you are captain of the Jordanian Invictus Games team for wounded veterans.
Yes.
Rola, you're brilliant. Thank you so much for sharing this amazing advice with us. I love you so much. Please give your family a hug and kiss for me. And we'll be in touch soon.
Thank you. And please send my warm regards to UT team and all of us. I miss you all, and I will never forget this experience, and I do appreciate it. Thank you so much. Thank you.